Well, aloha and good morning. It's great to have you here on this Aloha Friday, April 24th. And we made it through yet another week together. I'm Ryan Kalei-Suji with Yanji Denise, and welcome to the COVID-19 care conversation here on the platform of the Honolulu Star-Advertiser.
Yeah, we are so happy to be with you on this Friday. This is a conversation that's brought to you by the Star-Advertiser and our partners, the Hawaii Executive Collaborative, a consortium of business and civic leaders working to make Hawaii a better place. That's my mic check right there.
Every day she does that.
Always something, always something. Hey, we've got a great guest today. Kauai Mayor Derek Kawakami is joining us, and his island has an amazing distinction. Do you know that it's been 20 days since they have had a new case? We are seeing the flattening of the curve throughout the islands, Ryan. 4 new cases yesterday. That has been single digits for the last few days statewide. Really good to see.
Yeah, and again, a great statistic in that is 455 patients in Hawaii have recovered since the outbreak began. And so that is another number, of course, to look at, as well as the hospitalizations, which continue to remain stable. One of the fears, again, of this was that the hospitals would become overrun. So officials, as well as residents, have done a great job in getting the word out, making sure they're staying in, heeding all the warnings to ensure that we keep those numbers down and we actually keep the recovery numbers up.
Yeah. So across the islands, we are now seeing 596 cases positive so far. We'll get new numbers today around noon when the Department of Health releases their numbers. There's a really interesting push-pull that's happening between the City and County of Honolulu and the Department of Health when it comes to testing. The paper has a really good article on that today. Mayor Kurt Caldwell had announced a couple of days ago that the city would be investing $2 million to purchase 10,000 test kits. These are tests that are being used in countries like South Korea, in parts of Europe, but they are not the ones that are authorized or designated by the CDC and the FDA. So the Department of Health says there's a liability issue with this test and is really, Bruce Anderson there, really urging the city not to use them. So for now, Mayor Kurt Caldwell says he is holding off on the testing program, holding off on those 10,000 kits. And I think they're going to be doing a little bit more research and seeing what they can do. A big piece of this is testing, and a lot of people are really excited about getting those 10,000 test kits. So we'll see what happens with this one.
Yeah, we'll see what happens and how this kind of evolves. Again, Mayor saying that he's not saying no, but they're just kind of putting it on hold, getting the conversation going. But I think it also stems to a much larger conversation in the connection between the counties as well as the state officials and trying to find some sort of cohesive language and protocol that happens. But one county that has really done and set the bar, I think, for a lot of the other mayors has been Kauai County. And so we're going to bring in Kauai County Mayor Kawakami who's joining with us now. We're getting a little bit of feedback, so I don't know if there's another device on there.
Do you have a device on, maybe? Maybe there's a phone or something checking us?
It's the only thing coming out is this laptop. So that's the only account and only device that's on.
Okay.
Okay, well, we'll make it work. So let's start off with those no new cases in 20 days. What do you attribute that to?
We attribute it to being proactive as far as restricting movement, having a good team in place with a sound strategy that began working on our plans well in advance of the case arriving in Hawaii. So we had things set in place. And of course, we have a very close relationship with our district health officer, Dr. Janet Berriman, and the Department of Health, including Lauren Guest. They're in the EOC with us 7 days a week. And so depending on the disaster, that will depend on who we bring in as a subject matter expert. And it's important that we be able to have a voice with an expert in the field of disease, pandemics, viruses at the table. So I would say that is a huge factor, but I think more so than anything else, the island of Kauai has historically had their fair share of disasters. And so for the most part, the majority of the people know exactly what needs to be done. They are very compliant because they understand that this is in the interest of their health and safety. And, when we hear that this impacts our kupuna. I think culturally, it's ingrained in us to be fiercely protective of our elders. And so those factors, I think, all came together to show relatively good signs of success to this point.
One of the things that we're noticing, and again, I mentioned it a little earlier, is just somewhat of not necessarily a disconnect, but there's just different communication that somewhat comes forth. Of course, there's the president and the administration that says one thing, and then the state on the government levels, the governors are telling residents something else, and then mayors sometimes will have a different type of order for the residents. How have you been able to manage with all these different levels of command sort of coming down from the top down, and you being on the ground there, having to make decisions for your community?
Well, I think there in itself lies the problem. Oftentimes in these situations, and no fault to anybody, but perhaps politicians, elected officials feel compelled to get out there in front and have a statement to say, to feel I'm trying to be tactful, which is not my strong point. Let's put it this way. I think as far as communication, we have a good sound communication plan because we've been here before when we've had disasters. So whether it's channeling our requests for assistance through HIEMA, through Meyer and General Hara, and knowing exactly communication channels are key is one thing. Staying to your strategy and to the structure and being disciplined enough to stay in your lane is another key. But what we do is we use best practices and science to make our decisions because, Hawaii has an advantage in a sense that, we're kind of like the last, well, it seems like we're the last area to be affected by COVID-19. So we had a chance to see what China did, what Asia did, what Europe did, and what they didn't do. And then as the knowledge about this virus evolves, it allows us to be able to shift and pivot very quickly to adjust our strategy to that. So it's about knowing what information is pertinent, being able to filter out things that may be misleading. But what it really boils down to is trust. There's so many different voices, so many different philosophies. At the end of the day, I trust the folks in this room, our own district health officer, our own people, and I trust my instinct because that's one thing that you have to rely on as well, especially when you're dealing with something that you can't see, an invisible enemy, something that can sit in somebody for a long time and then show itself after 2 weeks. You cannot wait around to get all the information because that will never happen. And so we're all born with these instincts that a lot of people have forgotten to be able to use, but it is a means of survival. And very early on, we have to use our gut instinct to say we're not going to wait around and not going to let our healthcare workers, our emergency doctors, our doctors, nurses, our frontline first responders get exposed like they have in other big cities. That was one thing we said, nah, this is not going to happen here. So we did what we had to do.
I wonder, the mayor of Honolulu has now extended the stay-at-home order for his county until the end of May. The governor is supposed to make an announcement in the next few days about whether or not he's going to extend the statewide order. What have you decided for Kauai?
Well, we're waiting for the governor to make his announcement. If he extends, we're going to extend. But nonetheless, if he doesn't make the announcement to extend, we are not ready to resume back to normal as of yet. We're looking at May 3rd because our standard here on Kauai is we look for 2 incubation periods from the last community transmitted case, which we only have one that we know of. We only have one. And so we look for 2 incubation periods from that case to May 3rd. And then we're going to start loosening things up much more in line to the governor's emergency proclamation as far as defining essential and non-essential work. So a lot more construction, a lot more local economy will get up there. But then we still have to make adjustments as far as what kind of safety requirements we're going to mandate upon these industries. It's not going to just be like, go get them, fellas. It's going to all be coordinated with how many workers can be at a location. You have to have a hand washing station. Of course, now on Kauai, everyone's mandated to wear masks in a work environment and in a public setting. So that is what we're looking at for May 3rd, if we can keep our numbers flat like they have been. Now, to extend overall to the end of May, we're looking for and we're waiting for guidance from the governor. And when he makes that announcement, we're prepared to follow suit.
One of the things that you folks implemented early on was that curfew and making sure that residents stay at home. How long do you foresee that happening, and how effective do you think that overall has been?
Well, I think what we have to do is rewind and go back to the intent of the curfew. We put the curfew in quickly because, Kauai is especially vulnerable. We don't have the type of resources that the city and county of Honolulu, Maui, and Big Island have as far as their healthcare system. We have very few ICU beds, very few ventilators, and we got to protect our first responders and healthcare workers because that's all we got. So the curfew was put in place as a means to increase social distancing. Everybody knows that when it gets dark and when it gets late, that's when bad decisions are made, especially if alcohol is involved. So we wanted to cut back on the number of unnecessary incidents that our first responders had to attend to, because we have to realize every time there's an emergency, that's a set of PPE and N95s that get burned through, and we knew that we had to reserve those resources if infection rates for COVID-19 really started to see an upward trend. So the curfew is doing great. There's really nothing to do on Kauai anyway. Like, that's the truth. That's what we're known for. But it still allows people to go fishing. Still allows people to go to work. But for everybody else, they should be at home. That is the safest place. And we get reports from Wilcox Hospital that ER visits have decreased by 50%. And, every single doctor and nurse that I've run into has said, thank you for putting that curfew in. So I think first and foremost, people need to understand that this curfew is put in place to preserve our resources, keep people healthy. But first and foremost, for us, the original intent was to make sure we take care of our doctors and our nurses, because we saw how horrible it is in some cities where you have nurses and doctors getting sick. The very people that we depend on to take care of us every single day. Well, now it's our turn to return the favor and take care of them.
I want to bring in the audience here. Kavika Smith has a question about whether school might resume. Hawaii is in an interesting circumstance, unlike other states, because we have different counties, but we have one school district. So I'm interested to know what your thoughts on school are. Obviously the state sort of has to all ramp up together, as opposed to Kauai just opening schools, or do you see the counties trying to take that on individually? What are your thoughts on that?
Hey, what's up, Kavika? I know him. He can call me and text me, but he go on the news. I know you. Nah, I just playing. I think it's the right Kavika. Kavika, we're in constant communication with Bill Arakaki. And, we also had Superintendent Kishimoto give me a call a week ago. And Kavika, I wish I had a good crystal ball for you, but I think for DOE as well, they're formulating their timeline as we formulate our timeline. And, I cannot answer as to when schools will resume, but I can tell you it's probably going to be when the level of having school as we're used to having it is defined as low risk or are relatively low risk because I think first and foremost, that's the top priority. I know that schools have pivoted towards online learning, and that is a challenge. My wife, Monica, is a 6th grade middle school teacher at Kauai Middle, and it's a challenge. And, we have areas where we now have identified as issues that we're going to have to resolve moving into the future. So a lot of kids don't have Wi-Fi and internet access, so we're going to have to resolve those issues. Many children don't have computers or devices. There is no set standard for a digital classroom. So these are things that are going to need to be worked on concurrently. But for now, Kavika, I think they announced that school will not resume for this year. When it will resume, as soon as we find out, we will throw it up on our COVID-19 updates that we provide daily.
Amidst all of this, at one point in time, a few weeks back, you guys had to deal with rain and flooding that was happening. And we're seeing actually more and more of that happening on the North Shore of Hawaii with just getting pummeled with the rain. How do you manage just two of these disasters happening at the same time? Some people having to move into shelters. I mean, do you guys have a plan in place should that happen again and people are having to evacuate? So trying to keep people in shelters while maintaining that social distance because of the amount of rain that the North Shore is seeing on your island.
Yeah, it was like we had like a tsunami scare. We had tornadoes, we had flooding, we have this pandemic. I mean, we're waiting for a swarm of locusts to pop up on the radar. Kauai is well versed. We have, I would say, in my opinion, put it this way, I got the very best as far as incident command team and an incident management team and our emergency management administrator, Elkin Ushio, and his second in command, Chelsea Sakai. These folks are hammers. I mean, they're just, everybody in this building is born and bred to deal with disasters. And, it's their comfort zone. And so when these things happen concurrently, when they're happening together, it's amazing to see how fast they can deploy the plan to go and address this disaster. And I'm just amazed at their dedication. And I'm really amazed at their families' sacrifice to allow these folks to do what they do. But yeah, we have plans in place for whatever disaster should come our way. Tornadoes are a little bit tricky. So we just deal with it to the best of our ability. Of course, our first priority is the health and safety of our people. And then we figure everything out after that.
The wild card in all of this is as good as, the citizens of Kauai do. Once we start to bring visitors back, that presents an enormous challenge. I'm wondering, first off, what your thoughts are on lifting the inter-island quarantine so that people within the state can move around more freely. And second, what your thoughts are on how we safely bring the tourism industry back.
That's a tough question. As far as lifting the quarantine on inter-island arrivals, we're not even close to doing that, in my opinion. One, because, we don't have, when we talk about screening and taking temperature readings, of course, that's a good layer of protection, but we have to remember you can be asymptomatic, no fever, no symptoms for 14 days and still be infectious. So it's not a catch-all. What we're looking for is to have a good screening procedure in place first and foremost. And quite frankly, I'm not the expert in the subject matter. What we do in these type of occurrences is we channel it to a different division. So we do have the Kauai Visitors Bureau with Sue Kanoho. She works with the transportation companies, the hotel companies, to come out with best practices, of course, with guidance with Dr. Berriman's hand on everything. And they help formulate what that type of scenario is going to look like. But we're far from there right now, in my opinion. We're just focusing on maintaining and getting a local economy reestablished, which means construction, safety measures for restaurants once they can begin to start receiving guests in-house to dine in the restaurant. And so we're really just focused on the local economy. And right now, like, we're buying time for a vaccine, right? And we're buying time for an antiviral medication. And I'm not sure how close the world is to achieving that and getting it into mass production. But ideally, that is what we would like to see in place before we start seeing more arrivals here. Until then, I think the 14-day mandatory quarantine is a great idea. It's essential. And people shouldn't be traveling, period, unless you absolutely have to. If you're an essential worker or you have a medical condition, if you don't have to travel, you shouldn't. If you don't have to leave your home, you shouldn't. Like, right now is a time to let the virus take its course, and then for us to slowly emerge and build a local economy.
Well, I want to make sure I'm understanding you correctly. Are you saying that you don't think that we should have any visitors until we have a vaccine? Because then we're looking at,
No,
18 months would be, best case scenario.
Yeah, I said ideally that is what we would like to see. But like I said, put it this way, the system and the processes in place would have to convince me that the people of Kauai will be relatively safe. And, for us to check off and say, hey, we're ready. But we got to remember, the best line of defense for any type of virus is a disciplined social distancing program, everybody wearing masks to keep their germs to themselves, a good hand washing routine, your own personal hygiene, and your own ability to not get close to people are the best first lines of defense for this type of virus. So, like, look, that's a tough question. And but I can say, as of today, I don't see it happening anytime soon. I think it's going to be the last segment of our industry to really start a recovery effort on. And I know that's going to hurt, but this is the nature of what we're dealing with when the whole world is being impacted by the same virus.
Mayor, we're seeing a lot of comments of people who are singing your praises, that are complimenting you on your leadership skills and the things that you have done, and the way that you have kind of set Kauai County up for this successful number. But beyond just the results that you are having from this COVID-19 time, you're also making headlines by doing dances and doing things on social media, cooking demonstrations. Hey, you put it out there. Talk a little bit about, sort of, your, aside from your role here and in your capacity as mayor, but some of the things that you're doing to help bring some levity to this whole situation.
Yeah, I'm just an average Joe. I got lucky by, I don't know, God blessed me with being able to be mayor, and I love it. I feel honored to be a mayor in a time of crisis, because this is my comfort zone. It started off with my wife. She's a school teacher, and she was really worried about the kids where, the kids being at home. Some of those kids, the safest place for them is at school, in the classroom. And so, it started off with just an idea saying, hey, why don't we try to do like some crafts and, some projects. And then it just kind of, it set its foot in. And now it's like every single night I come home to my daughter. I'm like, look, we got this. And I'm like, but, I enjoy it. What it does is, I think, people are watching this history go down in front of their eyes, and they see a lot of negativity. They see a lot of fear. So we got enough of that going on for everybody to share and pass around. Our household, we refuse to live in fear. We're going to be very cautious, and we're going to be very protective of what we do, but we do not live in fear, because that's no way to live a life. And so we said, why don't we just try to sort of bring some hope and laughter, because that's the best medicine. And it gives me a chance to just be me. Like, that's just the guy I am. Like, most people that know me, they're tripping that I'm the mayor, because they know how much of a freedom-loving, free-spirited type of person that I am. And so I feel great that I get to just be me, and that people accept me for who I am, and that I don't have to put on a front and be a, straight up and down mayor. And it warms my heart, because, that's just who I am. And I feel, for the first time in a long time, like I'm being accepted, if that makes any sense.
Yeah, that's great. Well, thank you so much for taking the time to join us here today, and for answering the questions, and for sharing an update for your county. We wish you all the best, and we'll be here for a little bit, so maybe we can get you back on in a few weeks or so and get another update. So thank you for being with us, Mayor.
Thank you, folks, very much. And everybody, you guys take care. And we're all in this together. Even though I'm here on Kauai, we're all just rallying together as one. We're all one. Thank you, folks.
Aloha.
Thank you so much.
Aloha.
Great to hear from him there. And if you're not following the mayor on Instagram, you should be. It's Mr. and Mrs. Kawakami is his handle. And they release a lot of good content, Ryan.
Yeah, they do. And, it's a good way to, like you said, at night, stay engaged. But we heard a lot from that interview. I think he made some interesting points that I think a lot of people may forget. The resiliency, if you will, of the island of Kauai and its people, and the things that they've had to go through with the natural disasters. He's saying help to sort of set them up to prepare for such a time as this, when there's so much uncertainty. So saying it's sort of in their DNA, and their ability to sort of respond when needed, I thought was an interesting point that I really never thought about. But when you think about it, sure, Kauai has definitely had their fair share of, disasters and things that they've had to overcome.
Absolutely. These are the same folks who have weathered Iniki and countless other storms. And so wonderful to hear from him. Interesting to hear his take also on inter-island travel. That is one of the areas that we expect to be loosened first, but he's saying that the island is absolutely not ready. And when you look at having no new cases in 20 days, you can see why he would be so protective of that. He was saying that May 3rd is sort of the day that they look at to see, okay, can we start loosening now? He's waiting to take his cues from the governor. We do expect the governor to be making an announcement about any possible extension beyond April 30th. And the governor will be here on this program on Monday. So if we don't hear from him before then, making an announcement, we will be sure to ask him then. We also have some other headlines to go through as well.
That's right. We have a lot of news heading into this weekend. Of course, yesterday, the mayor sort of talking a little bit more about, Honolulu Mayor Kurt Caldwell talking more about how they're sort of planning to unroll and how we're going to begin to start seeing things opening. And so they sort of put together a risk assessment, if you will, of the businesses and the things that will slowly begin to be allowed happening once again here on the island of Oahu.
Yeah, this is really interesting. And if you haven't had a chance, go to oneoahu.org. They have all of these slides, and it really breaks it down very easily. Of course, parks reopening on Saturday. That's tomorrow morning, 5 a.m. You can get out there. Only exercise, though. No picnics, no team sports, no playground equipment allowed to be used. Along with the low risk that they've identified, they're looking at golf courses, car dealerships, real estate, and certain businesses that can do maybe some online ordering, and then they deliver to your car. So maybe some kind of retail. And then the medium risk, which would be the next phase, and this could be in a couple weeks from now, again, before May 31st. They're looking at certain retail stores where maybe they'd do half of the normal occupancy in there, pet grooming, office environments with a mask, with social distancing, and then outdoor malls. So you're thinking like strip malls, things like that, where there's still plenty of airflow, you're not in an enclosed area. And again, they would do that with social distancing. And then they also have some slides on high risk and, way down the line, very difficult to modify. So go to oneoahu.org. That really lays it out. I thought those graphics were very helpful.
That's right. And it looks like some of the things that a lot of people enjoy will just have to wait. And so we'll wait to get further guidance from the city and county of Honolulu on just when those things will open. We also got some sad news for those who live here on the island of Oahu, and maybe those who live on the neighbor islands. This is a place that has become sort of a staple here in the islands. After 67 years in business, Likelike Drive-In will officially close on April 30th. They tried doing the takeout business that a lot of these restaurants are now doing, but it just didn't kind of fit their business model. They have said that 50 employees will be laid off, some of them working for the restaurant for over 40, 50 years. So these people, of course, have become institutions in that restaurant and so many familiar faces. I know I have so many childhood experiences of going there whenever originally from the Big Island, coming to Oahu, we eat here all the time. So it's another sad casualty of this pandemic and how it's really hitting some of these businesses that have become staples in our community.
Yeah, a restaurant like that is one that you just sort of, you come to expect it to be there, open late at night, sometimes even overnight, depending on the day of the week. And it's just one of those places that you feel like you can count on. And we are so sad to see them closing. So we send them our aloha, and especially those 50 employees that you talk about, some of them working there for decades, just heartbreaking to see. So when you're doing your takeout orders, think local, try to support our mom and pop businesses, because when this is all over, we really do want them to still be there.
Yeah, and it's becoming more and more difficult, I think, for some of these businesses to stay open. A lot of these businesses have applied for that federal PPP loan that we did also get word that a new wave will be coming out. So we'll hopefully have somebody on next week to sort of address that, to talk a little bit more about potentially that next wave to hopefully keep more of these businesses alive. Of course, we like to always highlight some of the good that's happening in the community, and we're seeing community members and companies really rally together to support those in need, and it's such a great thing to see. We also have seen this campaign that the Show Aloha Challenge is sort of taking on a different approach coming up soon.
Yeah, on Sunday, they're going to be giving away 1,000 boxes of food. These are like family packs. So if you go to pick one up, they're partnering with Latour over on Nimitz. You can see there's a little map right there. I know that if you've been there, that parking lot can be kind of a crunch, and they are going to have Honolulu police officers there to help direct traffic. You have to have a kid in the car in order to qualify to get a box. They're going to open at 8 o'clock in the morning, and all of those vendors that you see, those logos there, Meadow Gold, Mira, Waihata, Loves, KKK Distributors, and Wyola, all helping to put these boxes together. And, the more kids you have in the car, the more food that you get. So they really want to encourage people to come down. Starts at 8 o'clock, and we appreciate them providing families with some much needed food and care.
Yeah, it's so great to see. And it's really interesting to see how creative some of these people are and these companies and these causes are getting just to be able to support. Of course, we've seen similar drives like this, but nothing specifically for families. So them saying that you have to have a child in your car. So make sure that if you are going there, you're not saying, I have someone at home. Bring them with you, because you won't be able to get any of those boxes and support if you don't have them. So make sure that the keiki is in the car. Also coming up, again, this weekend here on the island of Oahu, we're seeing more testing that's happening. This one that's coming up again this weekend. Free testing is happening out in Ewa, but you can get more details and more information on testing that the city is doing over the weekend and through the next week at oneoahu.org. So if you think that you have maybe some of the symptoms, and again, you have to make sure that you do qualify for this test, head over to oneoahu.org for more information on how you can get a free test.
Yeah, that testing in Ewa happening today, and oneoahu.org has lists of other testing sites that are happening throughout the weekend, so we wanted to flag that for you. The other thing that we definitely want to encourage you to do is fill out the census. Go to 2020census.gov. Remember that now more than ever, we need to be counted, because those federal dollars are tied to population, and Hawaii needs to raise its hand and make sure that we get our fair share. The way you do that and the way you get political representation is by being counted, by filling out the census. You should have gotten a census form probably in the mail. If you haven't, go to 2020census.gov, fill it out, takes 10 minutes, and that way we all raise our hands and are counted in that survey.
That's right. And finally, one other thing that you can do, where I know we're kind of piling it on everybody here, things you can do. But another way is to help our kupuna. We are doing letters for kupuna over at coronavirushawaii.com. We have just under 1,000 letters that have come in this week alone. So that's great news. We want to thank everybody for sending in their letters and encourage all of you to continue to send them in. We're looking to get anywhere between 5 and potentially 8,000 letters that we want to get distributed because of the amount of seniors that are in these care facilities throughout the state. And so we are encouraging all of you to write your letters to our kupuna. You can find more information about the specifics and how it can get done over on our website at coronavirushawaii.com. You can either do it digitally or you can write it yourself. Encourage kids to write multiple letters because this is going to be something that we feel will be, again, the elderly will be sort of the last to get released sort of in this quarantine lockdown phase. We want to make sure that we send them our aloha. So head over to coronavirushawaii.com.
Yes, and Keone is asking a question about the food from the Aloha Challenge. Yes, the food is free. You do have to have a keiki in your car, though, to receive a box because these are designed for families and they want you to be able to prove that you are indeed a family. Carrie also has a question about self-employed and gig workers on Kauai. We are going to have Scott Murakami on again on Tuesday. That's the director of the Department of Labor and Industrial Relations. And we will be asking him again about those self-employed folks because we know that they are one of the groups that has been sort of lost in the shuffle here that does need help very desperately. So please tune in on Tuesday. We're going to be talking to him about that.
Or again, you can head over to coronavirushawaii.com. We've actually taken his interview, Scott Murakami's interview, and we've split them up. We've spliced up all of the questions specific to all these different topics that we covered so that it is more manageable so you don't have to scroll through our entire interview. So head on over to that website or our YouTube page and you can get all the answers and responses from him that we covered this week. And again, we'll talk to him on Tuesday. We also have Governor Ige joining us on Monday, and the governor has committed to spending the next few Mondays here with us on the Honolulu Star-Advertiser Facebook page. So want to encourage you to come on over here again on Monday at 10:30, where we'll talk to the governor, get an update maybe to hear more about when the state plans to sort of lift some of the orders and get an update again on the counts and the efforts being made by the state as well.
If you live in the city and county of Honolulu, go enjoy the park tomorrow. Make sure you maintain that social distance. But I know a lot of folks, a lot of families and individuals excited to get outside, stop jogging on the sidewalk, and actually have a little grass under your feet. So we hope you have a great weekend. Stay safe, wear a mask, keep doing what you're doing. We are all in this together, as the mayor said. We so appreciate you joining us here every day, every weekday at 10:30. Until Monday, have a great weekend, stay safe, and we will see you then.
Aloha. We'll see you next weekend or next week, 10:30.